Hi, my name's Amy. I'm a registered nurse for Dr. Duncan Taylor, who's a plastic and reconstructive surgeon in Perth, Western Australia. Fat grafting is a key surgical technique used by plastic and reconstructive surgeons to address contour irregularities after a mastectomy or breast reconstruction. In the process of breast reconstruction, it's important to understand the various techniques available and why they're used. Dr. Duncan Taylor will now explain to you the process of fat grafting, the benefits of fat grafting, and what you can expect.
My name is Duncan Taylor. I'm a plastic and reconstructive surgeon, and I have a subspecialty interest in breast cancer reconstruction and breast aesthetic surgery. Fat grafting is a technique to transplant small aliquots, small portions of fat, into the breast in this situation where there may be a contour deformity or an irregularity to the shape of the breast, which is commonly after a mastectomy or a wide local excision or a reconstruction where the shape has been altered. Fat grafting has a number of benefits in that it is a lower risk procedure. It can be performed as a day case or as a single night stay. And the tissue which is transplanted, if done carefully and accurately, has a high retention rate. A certain proportion of the fat will be reabsorbed by the body. This is generally around 20%. But the remaining portion reconstitutes and stabilizes within the soft tissue and then becomes a normal part of your body and has the advantage of not only just changing the shape and the contour, but actually also of having longer term improvement to the quality of the tissue, including the fat or the breast tissue and the overlying skin. From a single round of transfer of fat to the breast in a fat grafting technique, my personal preference, depending upon the size of the breast, is not to place more than 150 to 200 cc's of fat. This is essentially related to the fact that the breast has to receive that fatty tissue, and if you place large aliquots of fat into the same position, then one of the complications and the downsides of fat transferring is what's called fat necrosis, which is where that lump of fatty tissue doesn't survive because there's too much there. And then you can have harder lumps, or the body reabsorbs the fatty tissue such that it all gets dissipated and disappears over a period of time. In order to get a high retention of the fat, then it has to be placed in lots of small areas with small volumes, essentially. And in order to do that, there's limits in terms of how much you can place. This is dependent upon the size of the breast, the volume of the glandular component which remains, and the availability of fat from a donor site, such as the abdomen or the thighs, for example, to be able to harvest the fat for transfer.
We hope these videos have been a valuable resource to you. For more information about what breast reconstruction options and resources are available to you, please visit Dr. Duncan Taylor's website for more information.